Work the Levator Scapula in a very different way. I've never seen anyone actually do this. The Levator Scapula is a very problematic muscle in our clients. People who come to us and they grab their neck and they put their hand here on the local ligament is a telltale sign of levator issues, or if they say the crook of their neck hurts. So people come saying my neck hurts and they cradle their neck, they're normally telling us that there's some shortness, trigger point activity going on in the levator. The levator is commonly tight as per the Yander's upper cross syndrome. A couple of key things to remember about the levator. It attaches or it originates from the underside of the superior scapula. And as it makes its way up to C1, 2, 3 and 4, these digitations, they have like a twist in them. So sometimes when you go to a massage therapist, they'll palpate across this knot. And that knot is generally not a knot. It's a lot of knots, right? It's a twisting of those digitations. So when you work on people, you don't want to be cranking across this too much. Of course, that will need work, but you're not going to get rid of that mound of tissue because it's there by design. So the way I like to release the levator in this position is via moving the scapula. Couple of reasons we do this. We can get our fingers directly onto the bone. So in our Assess and Correct class, we go over this in a lot of detail. We want to address the insertion points at the periosteum. When we address the periosteum, that's where a lot of the neurological activity occurs. So we can really get a good Golgi tendon organ release. We can really release those interstitial fibers, etc. And it allows us to really work the muscle in a very profound and a very deep way. So, too much talking. So I'm going to remove Kiki's brush up just slightly. So what I want to do, I want to bend your elbow a little bit, Kiki, like this. Unrehearsed, as you can tell. The reason why we bend the elbow is just so, see, it pops up her shoulder blade. It's just easier for me to grab. If I'm here, especially if I've got massage cream, it's harder for me to manipulate her shoulder blade. And the reason we want to manipulate her shoulder blade, so the shoulder blade is here, right guys? So imagine this is her shoulder blade. The Levator Scapula attaches onto the underside of the shoulder blade. So we have to go beyond the trap. So what I do, I pull Kiki's shoulder blade onto my fingers here. So right now, I can't really feel the bone, but when I pull here, I'm pulling Kiki's shoulder blade onto my fingers as opposed to fishing around in here. So I'm here, my hands relaxing on the cradle. These fingers are hooked like so. Middle finger pulled in, so I'm creating this platform of 3 fingers. Kiki takes a deep breath in. As she breathes out, I pull her shoulder blade onto my fingers. How's that feel?
Good.
That look good. That tender?
The
So once I feel secure in my palpation, then I'm going to start sort of adding in some undulation of Kiki's shoulder blade to create some release. We can change the position. I can pull her this way, so that's going to create shoulder rotation, shoulder blade rotation, scapular rotation. So I can pull this way, I can push, I can even twist and bind. I can twist and bind this way. If the client's okay with it, they're not jumping around like crazy, some of your clients will, some of mine do, I can have Kiki shrug her shoulders. So now she's pushing her shoulder blade into my fingers, and then she depresses. She shrugs, and she depresses. Go one more, shrug, and depresses. So she's moving her shoulder blade back and forth. A couple of other arm positions we can use. Cradle the back of your head, Kiki, with your arm, like this. So I'm going to try and show this for camera reasons. So I'm going to use a thumb So I'm going to balance her on my knee here. I'm going to come under. And I'm going to come in this way. It's a little bit harder to get under the shoulder blade. Just relax. So now I'm coming underneath. This is better for me. So I'm here, I'm coming under. And now I'm using this hand to just compress against. So here guys, I'm not right under the shoulder blade, but I'm just on the tip of the shoulder blade. So I'm hitting it from a slightly different angle, more tender. So the reason this position is a bit more tender for Kiki and a bit more profound, the shoulder blade inserts here, from here to here. So when Kiki puts her hand behind her head, do that for me please. This creates upward rotation of the shoulder blade. So these 2 points move away from each other, you see. So come back to neutral. So if we're saying the levator scapulae is in around this spot, guys, and then she puts her hand on her shoulder, that spot moves away from me. So this is a way to create length. And this is one of the ways we stretch it. Just relax. Whenever I work levator at the scapular insertion point, I always come in to the upper neck and I'll work just a bit of palpation through the lateral processes of C1, 2, 3, and 4. So shoulder blade, palpate through the upper neck, and as a rule I always finish off with, if I'm doing this deep work that is not totally relaxing and pleasant most of the time or some of the time, I always generally finish off with like a cross body myofascial stretch, which is a bit more therapeutic, a bit nicer, a bit more relaxing. Would you agree? Mm-hmm. So here I'm just pushing, scooping, here. And we're finishing around the local ligament, because like I said, most clients who come in with levator issues unwittingly will cradle their neck and their nuchal ligament. So this is very simple. Pull, hook my fingers, push away. So this is stretching upper trap and levator. So yeah, levator's key muscle to address, especially with our forward head posture clients with limited neck rotation, limited side bending and or pain. Especially levator is very important to assess and correct and treat on clients who get neck pain when they walk. I've had a lot of clients come to me, my neck hurts after I walk, and that's partly due to the levator inserts onto the scapula we just discussed. So if they're walking in a certain way, less than the ideal way, they are going to get some funky shoulder blade motion going on repetitively, and that can lead to neck pain. So ask your clients how, when, why their neck hurts and start trying to piece the puzzles together. But definitely try this technique out.